Hey everyone, it's Dr. Danish here. If you or someone you love is living with bipolar disorder, chances are you've heard of Depakote, maybe under its other names like valproic acid or divalproic sodium. And maybe you've also heard it's a bit old school, that it's not always the first line choice anymore. Those are true. But here's the twist. Depakote still works for many. Sometimes it works when nothing else does. So today, I'm taking a clear-eyed look at this powerful medication, what Depakote actually is supposed to do, why some people still swear by it, and what the true risks are that you or someone you love really needs to watch out for. Let's walk through the good, the bad, and of course, my take on it. Depakote is a mood stabilizer with a surprisingly wide range of uses, both FDA-approved and off-label. It's officially FDA-approved to treat manic episodes in bipolar disorder, certain types of seizure disorders, and to prevent migraine headaches. But in the real world, especially the real world of psychiatry, we sometimes use it off-label for things like intermittent explosive disorder or severe anger, irritability related to autism spectrum conditions, aggression or agitation in mood disorders, rapid cycling in bipolar disorder, mood stability in conditions like schizophrenia or other psychotic disorders. Also in patients with a history of traumatic brain injury. So, what makes Depakote different from other mood stabilizers? Well, it works through multiple pathways in the brain. First, it boosts levels of GABA, your brain's main calming chemical. That helps quiet overactive nerve signals. Second, it regulates sodium and calcium channels, both of which affect how neurons fire. And finally, it influences long-term brain function by changing how certain genes are expressed through something called HDAC or HDAC inhibition. This even impacts brain health markers like BDNF or brain-derived neurotrophic factor, which is important in actually promoting neuroplasticity and even neurogenesis. This in turn has huge benefits for mood, memory, and even circadian rhythm. Now, that's a lot of neuroscience, and I promise I'll stop here. But here's the bottom line. Because Depakote touches so many systems, it can help with a broad range of symptoms, from intense mania to intense anger to seizures to migraines. So the big question is this: does Depakote still hold up in 2025? According to a very large recent article review, here's what we know. It clearly beats placebo for treating acute manic symptoms. It's about as effective as lithium is for mania, in fact, and that's incredible considering lithium is one of the gold standards in bipolar disorder. It shows modest benefit for bipolar depression, although it is not FDA approved for that, and it helps reduce relapse when you are in a stable state in bipolar. It helps prevent either depression or mania from occurring. Here's a practical tip I always share with my patients. If you're going to try Depakote, Depakote extended release or Depakote ER is usually the way to go. Why is that? Once a day dosing extended release preparation at night is much easier on the patient's body and works even better than 2 times a day immediate release. Blood levels stay more stable and consistent, GI side effects are much milder, and when taken at night, it can reduce daytime drowsiness or dizziness. Personally, I almost always go with the ER version taken at bedtime. It just tends to be a smoother ride. Let's talk about trade-offs, because while Depakote can be a game changer for some, it's not without risk. So why is it not used as often as it once was? Mainly because of its side effect profile, as well as the need for ongoing laboratory monitoring. Some side effects are rare but serious, while others are more common and manageable. Let's break it down. Rare but serious risks you must watch for. Liver toxicity, usually within the first 6 months of starting the medication. In this case, watch for symptoms like fatigue, yellowing of the skin or the whites of your eyes, or dark urine. Pancreatitis, which manifests as sudden pain, nausea, vomiting, diarrhea. That's an emergency situation and you should go to the ER immediately. In some cases, even when liver function is normal, some patients develop something called high ammonia in their blood, and this can lead to a delirium, which causes confusion, sluggishness, and personality changes. In these cases, the Depakote needs to be stopped and the ammonia falls back and the patient returns to their baseline level. In women, there is a slight increase in the incidence of something called polycystic ovarian syndrome, so that needs to be known. Depakote should never be used in any woman who plans on getting pregnant or is pregnant. So make sure if you are of childbearing age and you are sexually active, you are on birth control. Some other side effects that I watch for in my patients that can lead to them wanting to stop it are weight gain, thinning of the hair, and there are some ways to mitigate this, and I'll be sure to put that in the handout that I provide for you through my Mind Vault. And then some patients do complain of feeling a little bit slowed mentally or brain fog. The stomach upset that I mentioned before usually can be mitigated by taking the extended release version or taking that with food. Lab monitoring is critical, as I mentioned before. That means looking at liver function tests, both initially and then within the first few months, blood counts to monitor platelets and white blood cell count, ammonia levels if there's a sudden change in mood, memory, or cognition. And then we always look at the Depakote level in the blood, or the valproic acid level. There is a specific range when you're treating someone for bipolar and trying to prevent them from getting manic, or if they are manic, you're going to go for a higher range. And again, I'll put that in the Mind Vault resource so you know what to look for. Usually I recommend getting the blood drawn 12 to 14 hours after the last dose. And usually you take at least a week before getting the blood level checked so that your states can reach what's called a steady state or equilibrium state in your blood. And again, that'll be mentioned in the Mind Vault resource. There are a list of medications you need to avoid when taking Depakote, and I'll be sure to include that list. Some of those include aspirin, topiramate, carbamazepine, Klonopin, warfarin, and again, some others that are a little bit less commonly taken, I'll be sure to include on that list. Always check with your prescriber to make sure they do a medication interaction check before starting Depakote. Depakote is a hard no with anyone who has active liver disease or for women who are pregnant or planning on becoming pregnant. Yes, there is a lot to consider with Depakote, but for that reason, I put together a full guide in my Mind Vault at drdaviddanish.com. It includes detailed checklists, full list of the side effects, and lab guides to help you stay safe and informed. It makes all of this information easy to follow, and I'll put that link in the description, so be sure to grab it. Here's how I think about Depakote in the real world practice. It's not my first pick for most bipolar patients. It's not even my second pick a lot of the time. But when other options have not worked, I've seen Depakote turn things around. I find it especially helpful in agitated or irritable manic episodes, mixed episodes where mania and depression coexist or overlap together, rapid cycling bipolar disorder, cases with overlapping seizures and bipolar disorder, or those who are suffering from severe migraines that are not responding to other types of treatment, along with mood disorders. Some of my traumatic brain injury patients who suffer from severe anger and impulsivity also benefit from Depakote. Some of my patients with autism who have failed other types of medications, including atypical antipsychotics or alpha-2 agonists, I will often do a trial of Depakote with them. Again, I always use extended release preparations given once a day at nighttime. It leads to less side effects, more compliance, and actually more efficacy in treating the disorder. Depakote might not be the newest, sexiest kid on the block, but when it fits, it brings order to chaos in ways other medications sometimes do not. So, is Depakote worth considering? For some people, absolutely. It's not right for everyone. It comes with risks and it requires ongoing monitoring and working with an experienced provider. But for intense manic episodes, frequent cycling, or coexisting neurologic issues, it can really get the job done where other medications fail.